As the new Delta variant sweeps across the world, the new Israeli administration attempting to prevent its spread within Israel through a policy of maximum protection and minimum disruption. Here to discuss the latest cabinet decisions is Professor Nadav Davidovitch from the Department of Health Systems Management from Ben-Gurion University in the Negev. Welcome. So first of all, we've seen outbreaks in Binyamina, a city which is still red, and other cities which are turning from green to red and yellow, though it seems the number of cases seems to have dropped. So what can you tell us about the state of the virus spread in Israel at the moment?
So actually, it's not a big surprise. We were aware that there are going to be different variants. The Delta variant is spreading about 50% faster. We see localized outbreaks mainly because there are children that are not immunized, and unfortunately, all the entrants from abroad. The situation at the Ben Gurion airport was still very problematic. I hope these things are going to be solved with the new Tsar of the airport, Ronnie Numa, is a general, and I think the integration of work is very important here. What we need to do now is speeding up vaccination, especially among those who are 50 years older that are in high risk, about 200,000 of them. And of course, children that now we know that it's safe and efficient to vaccinate. My child is going to be vaccinated second dose tomorrow. He's 14 and very excited.
So given this picture that you've just presented, you seem to agree with the cabinet decision not to impose any sanctions. Is that the right decision, you think?
This was our recommendation from the cabinet of experts. We have now, again, masks that should be wearing closed places. We need to still continue and follow the situation. If a number of cases is going to be increased, there is an option to return the green pass. The only thing is that we must supply also tests that are going to be maybe subsidized. And again, the situation at the airport that should be tightened. Otherwise, we need to learn to live with the virus. This is the most important recommendation because this is not going to be eradicated, especially since there are gaps that are huge among different countries. So speeding up vaccines, Ben Gurion Airport, masks, and also personal behavior, hygiene, all of that, and responsibility. We're not expected to see a fourth wave as we saw in previous ones in January and October because we have high rates of vaccinations.
And is there a risk of a fourth wave with children since they are currently not vaccinated?
We're probably going to see some local outbreaks among children. Of course, I urge children that can, those who are over 12 to be vaccinated. Those who are younger, again, there might be an option for some local outbreaks, but if we keep hygiene, if we keep masks in closed places, and also when people are returning from abroad, they should comply with all the regulations. I think that this is something that can keep the outbreak in a kind of a the new normal phase without getting the high number of severe cases and hospitalization that we saw in previous months. So we need to learn to live with the virus. This is the main message here.
The main message. All right, Professor Nadav Davidovitch, thank you so much for taking the time to speak with us, and good health to all.